been told this is being recorded. Yeah. Now, I'm going to present some slides, but just full disclosure, you can Google COVID-19 dashboard Washington State, and it'll the second link will put you right into this. I pulled these slides on Thursday. I double checked them this morning, and the numbers haven't changed too much, although actually they've ticked up a little bit. We're at about on Thursday, we were at 208 cases per 100,000, and as of this morning, we were 228 cases per 100,000. But again, spoiler alert, I want to start off by saying what I tell my patients is that COVID-19 is something that we should absolutely still be paying a lot of attention to. But we're still doing okay, although we should have some level of concern about this recent, what looks to be the start of another surge. So this is the state summary slide. The number that I do pay attention to that's reported in the newspaper a lot is cases per 100,000. That gives us an idea of the disease burden in the community. And as you can see, we are running at a bit of a little spike here, a surge. But at this point, nothing compared to back in January, where we got up to almost 2,000 cases per 100,000. So that's the red part, that top number. Now the orange level, that second one, that's the one that my friends who work in the hospitals pay the most attention to. What percent of patients who are in the hospital because of COVID-19? This speaks to the healthcare system's concern for being overwhelmed by COVID. And at this point, they're not overwhelmed by COVID in the hospital. We're seeing an uptick, but most people are in the hospital for different reasons than COVID. And then that bottom number there is about vaccinations. About 70% of Washington State residents have actually completed a 2-shot series. And I've got another slide a little later showing that in terms of actually the at-risk population, we're running above the 80%. So in terms of people that really needed it, over 8 in 10 people have had their primary series vaccination.
我大略简单的翻译一下哈，如果没有忘记的话哈，那他现在基本上谈的是我们华盛顿州的资料哈。那大家看左上角这个208这个呢，就是说每10万个人里面最近的呢是208个个案哦。那在2-3个月前，大概到2000多个哦，每10万2000多个这样，所以已经慢慢在下降了哦，而且下降的还算可以哦。那你看第二个6% 哦 ，6% 这个就是说医院里面的占传率哦是6%，所以呢表示呢并没有把医疗资源消耗掉哦，我们还有很多空间，所以表示住院率并不高哦，所以这个是那个 variant 哦，那个 Omicron 的情形哈，并不是那么恐怖哦。那现在68%的人完成那个疫苗注射了哦，所以你可以看到那个曲线哦，在1月的时候非常的高哦，那现在是稍微在慢慢在增加一些了哦，因为在 Omicron 最近有一点增加，但是还没有到非常危险的状态哦，所以呢，这个是大家还可以放心的过日子，好好的看这个曲线，然后做适当的保护哦。那它就是说，从 pandemic 现在已经进入 endemic 了哦，就是说大流行现在变成是地区小流行，所以呢，美国的状况呢应该是还算不错的哦。OK。
All right, next slide, please. Yeah, this zooms in on the disease activity, and I like looking at this one again to give a little perspective of what happened in January when Omicron came to Washington State, and this graph pretty closely mimics most other states in the U.S. Again, we are seeing a bit of a surge, and again, the most up-to-date number, this graph has it at 208. It's actually 228, so it is still, we are still on the upswing in Washington State. We're doing a lot more testing even now, though, than we did, not more testing, but testing is much more available to folks now than it was back in January. If you remember back in January and February, most of those drive-through PCR testing sites had really long lines, or you couldn't get an online appointment. And most, I know at my Shoreline Ever clinic, for a while, we were not able to do asymptomatic testing. For a while, we would only test someone with pretty significant symptoms because of supply. Right now, I'm happy to report that we actually have quite a lot of testing capacity. Most City of Seattle, City of Bellevue, King County, and Washington State testing centers have good accessibility, and also most clinics have PCR testing available. And so I almost feel that this recent surge, we're just getting a better picture. This is my personal opinion, as they were getting even a better picture than we did in January. And I would actually, again, personal speculation, I think the actual case rates were a lot higher in January than was depicted on what we captured.
最近呢，那个做筛检的PCR 的数字大量减少因为1月的时候，那时候是几乎排队排很长，都没办法做到那时候我记得华大呢，他们也是给报告要等好几天那现在呢，已经非常的空都大幅下降，而且现在用快筛的方式呢，就大量的提供给大家那就大家就减少去做 PCR 了那因为现在快筛的目的就是只是做筛检，来做一些活动的筛检而已所以现在大家的心情也放松下来不像1月的时候要做一个检查都找不到地方，没有人做那现在已经大量都有，很多诊所都可以做了这样。
Next slide, please. I like putting this one in because again, it leads into the slide after this about hospitalization rate. It's our vaccination percentage in Washington State that is keeping our hospital rate at acceptable levels, at maintainable levels. And fingers crossed that will continue through the summer and then into probably another expected surge this fall. But I have to say, overall, compared to the rest of the country, the vaccine rates are higher than average, and especially in King County, even higher than that. And again, congratulations to the vast majority of the more at-risk population of over age 65 in King County. The rates are also above 80%, which that's what's going to keep us all safe.
那个疫苗的注射率呢，我们华盛顿州是算领先全国做得非常好。那King County更加好所以呢，那个大概81.8%那这样的关系呢，我们医院的使用率都降非常的低就是因为 COVID-19 引起的问题就少很多这是值得大家鼓励OK。
Next slide, please. This is a little skewed because, of course, the population is much denser in Snohomish, King, and Pierce counties. But again, we're just saying that that's where the majority of vaccinations are given. Not too much else to say about this slide. I was going to say next slide, please. After the next slide. But again, this is the slide when I'm refreshing myself on the Washington State dashboards. This is the slide that I key into pretty quickly, which is hospital use in Washington State. How overloaded are hospitals? January, as you can see, was the highest disease burden in hospitals through this whole pandemic. And it was the first time that you saw such a Providence ever. There was National Guard was mobilized and was helping with kind of back office and logistics at Providence. And again, currently at these levels, we're not seeing that. We're still seeing a little bit of an uptick, but again, fortunately not to the levels that we saw back in January. And also we're not seeing the rate of rise in hospitalizations as steep as that curve was back in January.
这个曲线大家可以看到哈，那个从2020年10月到现在，它主要是它的医院哈的那个住院的情形的统计资料哈。那可以看到1月的时候住院，因为 COVID-19 住院的比例上升哈。那后来到4月已经下降了，最近还是有稍微慢慢在增加，好，这是统计资料，好。
Next slide, please. This is also just kind of an up-to-date on how many COVID-19 patients are in the hospital and how many of them are on ventilators. And again, numbers that we need to be paying attention to and watching. And but we're still looking, as of this was as 5/17, we're still looking okay. It's very serious for those 25 patients that are on ventilators, but in terms of capacity and hospital capacity and ability to, if someone does get ill and needs to be in the hospital, that there's the resources there to take care of them, we're actually looking okay.
这一张是跟大家解释，就是说左边这个呢是说医院因为 COVID-19 的病人的使用的情形哦，到5月17号是533床哦，在华盛顿州。那这里面右边这一边就是说需要用呼吸器的数额哦，并不高了哦，所以呢，这个是因为我们的防疫工作做得不错哦，那大家打疫苗啦，那还有保持距离这些呢。所以我们的情形并不是不好哦，还算不错。
Next slide, please. Because what changed between January and now? No one wears masks outside of healthcare facilities, nursing homes, or certain businesses. And so we're paying a lot of attention to these numbers, but even with everybody taking off the masks, fingers crossed, we're still doing okay in terms of hospital use. But and that's where I was happy that you guys asked about this question today for kind of COVID updates, because that's, in my mind, that's what changed. And I'll just give you my personal opinion. I'd be very surprised if we went back in terms of that society went back and they put back mask mandates. I'd be fine with it. I would comply. For the record, I absolutely trust our State Department of Health and our Governor Inslee, and I think we've got some really competent people making recommendations in the state of Washington and King County. But in terms of society's, how should we say, desire, I just doubt that we'd go back, making it a mandate. So I do have a slide in here on projections on how that's going to affect case rates. And again, fingers crossed, we should be okay. But if you've noticed that the people aren't wearing masks out and about, you're correct, because they're not. This is surveys that are done by University of Washington on mask use. And you can kind of see we're almost back to that summer of 2021 and even much lower. And even with this, Washington State runs about 20% mask use. If you go nationwide, this data it drops down into 15. Now, if you go back to Montana, I imagine it's single digits. And be happy to share the cultural insights for these different geographic areas. Next slide, please. Yeah, I put in the U.S. mask use slide. Yeah, the graphs are a little funny. They, if you looked on the left-hand side, the previous graph ended at 20. This one goes down to 15. And, yeah, U.S. mask use is a little bit lower. So Washington State's still a bit higher, but again, if you've noticed that people are taking masks off, you're correct. And I'd have to say, King County still has the highest amount of mask use in the state. Next slide, please. And this was interesting because there was the question of, certainly by taking off masks, we are seeing an expected uptick in case rate. And so by taking off masks, how many? It's a very fair question to ask how many people are probably going to die in the U.S. Because of not wearing masks. The University of Washington, their epidemiology department ran some projections out through September and presented this projection that they felt that if the 80% of people in the entire United States use masks outside of the homes, nationwide, based on their projections, would probably save about 12,000 lives. Currently, again, 19% of people are using masks. So it's a pretty wide variance, and I'd just like to put out that while it was an interesting, while I think it's a very good question to be asking, I just don't see the political will for putting back mask mandates.
现在这3张 slide 呢，前面讲的就是说我们的使用戴口罩的比例那华盛顿州是相当不错了那在全国里面也算相当顶尖的，大家都乖乖的用口罩所以呢，戴口罩的可以减少死亡率大概是12000个在美国，假如80% 的人戴口罩但是呢，现在就是说，到底要不要戴口罩呢？这个前面的曲线看起来，大家病严重的时候，大家乖乖的戴，然后不重的又打开都不戴了所以现在大概戴口罩的比例只有不到30了并不高。那今天的 news 我看到是又要考虑要不要拜托大家戴口罩因为口罩的保护力是还算不错了那我们华盛顿州的人大概都比较乖遵循所以呢，你看左边这个 slide 的那个黑色的，在我们西雅图区的呢是深黑色就大家比较乖会戴口罩。那也是这边的高科技公司也多了大家都认真的戴所以呢，这是他也在期待了我们大家或许乖一点，在家里的外面，那能够戴口罩就戴着，这样是比较好的但是这也是看大家愿不愿意，但是他不认为可能会强制大家戴口罩只是会拜托大家戴而已。
Thank you. Next slide, please. Actually, can we go back one slide? Before I talk about the... No, I'm sorry. Well, I've got a slide for questions. I want to be sure to stop for questions, but actually, let's present the next slide, please. I'd like to talk about the variants, and then I think the next slide is questions. Okay. Yeah. Again, this uptick, even in a over 80% vaccinated population, is due to the new COVID variant Omicron. And I just wanted to back up a little bit and go over also the Delta variant and compare that to the original SARS COVID-19 virus. there was, so SARS COVID-19 originally identified back in 2019. We have some pretty good data on that now in terms of how infectious it was. We give it a rating of infectivity or contagiousness. We call it an R0. And the definition of that is what would be the expected amount of infections resulting from each new infection. So if you're in a population of 100 people and one person got the original coronavirus infection, and those other 100 people are not vaccinated and also have never had the infection, they're naive to the virus, that one infection would be expected to cause about another 2.5 infections in those 100 people. Now, anything with an R0 above 1 has the potential for logarithmic growth. So an R0 of 2.5 is actually pretty infectious. For comparison, the typical or average seasonal flu, influenza virus, has an R0 of around 1.2. Don't quote me, it's around 1.2, Dr. Chin. Correct me, which is pretty infectious. So the original coronavirus, let's just speak a little generally, it's about twice as infectious or more as the flu. Well, later in 2020, the Delta variant is first identified in India. Doesn't mean it was created in India, but it was first identified there. And then about 9 months later, kind of in the fall of 2021, that's when it first arrives in the United States. The R0 of the Delta variant is about twice as infectious as the original Corona, 19, and 4 times more infectious than the flu. And so we see a pretty good surge in fall. And unfortunately, Delta variant also tended to cause more severe infections in the unvaccinated than the original coronavirus. And so that was the first major variant of concern that came to the United States. What we are currently seeing is Omicron. And for comparison, Omicron is first identified in South Africa, right at I think it's November 2021. By January, it's already all over the United States. And so that's how fast this one went. And while we're still learning a lot about Omicron, it's looking like the R0 or the contagiousness of Omicron is running between 8 to 12, meaning that in an unvaccinated, naive population, one person getting infected with Omicron would be expected to infect another 8 to 12 people. And that's pretty infectious. One of the most infectious viruses out there is measles. It runs an R0 between like 12 to 18. And in learning about it in medical school, that was the one where if you'd had a measles patient who was just in a room and then they left, and an hour later, someone else could walk in that room and catch measles. That's the type of infectivity we're seeing with the Omicron B2A. So pretty infectious. Omicron B2A now represents over 50% in the US. And so just in terms of how quickly it can spread. But again, if the original Corona had been this infectious, we would have faced those true catastrophe level situations, where now, because we're 2 years later and we have a majority vaccinated population, and you know, a lot of folks have already had an infection, we're reaching a level of herd immunity. And what's also happening is that this virus is following a pattern that we see in other pathogens, where as something spends a longer time in a population, it tends to become more infectious but less virulent. It tends not to kill as many people, but to spread and infect more. That would put it in line with the other 3 coronavirus viruses that we see in the population, not MERS and SARS, but there's 3 other coronaviruses that tend to cause the common cold. And so Omicron seems to be marching us down that path where it's here to stay. We will be dealing with coronavirus 19 for the rest of human existence, most likely, in my personal opinion. But we're moving more towards an endemic state where hopefully it won't be as disruptive for our society. So again, just to summarize, before I hand it over, we've taken off masks. There's a much more infectious COVID variant out there, Omicron B2A. It's absolutely causing a lot of infections in the community. And if someone is very susceptible, I think they should still be aware of it. And if someone is in a more high-risk population, I would recommend the N95 use out and about in the community. But for the general population, we're moving into more of a endemic situation where we're going to be living with this virus, and it does appear to be about the right time to be making long-term decisions on, what kind of adaptations we want to make. Again, though, still important to be watching the dashboards, because my personal projection is we'll continue to see a peak in case spikes. The next 4 weeks or so, we'll hope to see a peak in decline, fingers crossed, and then we'll see it again in the fall. Please take all this with a grain of salt. I've been wrong many, many times on many things before, and I could be wrong on this too.
You never wrong with your daughter's red hair. 这里就是总结了那本来最早的时候，2019年的武肺那个 SARS-CoV-2 开始的时候的传播力，跟现在呢去年的 Delta 呢，它是传播力是大概是 R 值2.5的就是说 Delta 比原始的 COVID-19 的那个病毒的传播力呢是高很多那但是呢，它那时候当然是也引起比较全世界全国恐慌的美国那时候也是相当严重，住院率也相当恐怖但是到后来，现在从去年11月的 Omicron 开始呢，它的传播力是比 Delta 更高大概2倍以上了它等于是说 Delta 它可以传的是大概 2.5大概这几个人，但是 Omicron 可以传到8个以上那它就是跟那个 Measles 麻疹是更恐怖大概12 8到12，也就是说你在麻疹的人在跟你同一个房间相处大家聚一聚呢，就非常容易得到。那 Omicron 也是接近这个样子非常容易得到。所以现在美国是50%的个案呢都是 Omicron 那去年都是 Delta。但是呢，这 Omicron 现在在这么大的流行但是并没有引起很大的严重的病所以呢，他的结论就是说，现在这个 COVID-19 已经转成另外一种病毒了那已经变成像地区传染了endemic 的传染了那大概再过一个月4个礼拜以后呢，希望这个整个疫情就更加稳定更少了那但是呢还是一样，大家还是要保护自己那该做的保护保持距离啦，戴口罩呢还是要做，这样才能够维持我们的群体免疫，然后大家比较可以快乐的过生活了那再来也就是说继续做你该做的事情，过好日子这样
Next slide, please. So I'd love to just pause and take questions.
请大家提问或提供意见。
I have a question.
Yes, Peter.
So what happened to Delta?
Yeah. It got pushed out. Got pushed out by Omicron. Fortunately, Omicron, natural infection provides a degree of immunity to Delta, and so Omicron pushed Delta out. Just
Great news.
Yeah, like good money drives out bad. Yeah.
Thank you.
大家有什么问题？大家已经都被吓倒了，还是都已经了解很清楚了？
Okay, I had one question. So is that safe to go to the restaurant?
Yeah, is it safe to go to a restaurant? That's it's a personal. You have to take into a personal choice. I go to restaurants with my kids and family. I currently have my in-laws also staying with us, and we don't go out to restaurants with them. They're in their later 70s. So
Okay,
that's our personal choice. My parents, who are also in their 70s, they go out to restaurants. And I'm comfortable with that. They both had they both had 4 shots now. I feel that their risk of hospitalization from a COVID infection is pretty low, and they love going out to restaurants. Like they take a lot of enjoyment from it, and I'm very comfortable with it. Yeah.
okay. So actually sit outside, outdoor restaurant probably more safe.
The risk of exposure in an outdoor environment is significantly lower than an indoor environment. So that's a lower risk situation. Again, personally, my parents go indoors, and I do too currently. You could catch me out and about in a restaurant.
Okay. Thank you. Thank you.
Dr. Taylor, same question regarding to eating out.
Yeah.
Do you recommend then, since it's indoor with a lot of people, do you recommend wear mask until food gets there? Then you take off, you have to take off.
I'm going to give you my personal opinion. How to quickly say this? The decision on going out to eat indoors or not, I don't think that there's much of a difference in outcome or risk of exposure in terms of how much someone wears their mask in the restaurant. I might have Dr. Chen comment on this too. Yes, if someone's going to be wearing a mask, yes, before the food gets there, if you'd like to lower your risk, you should continue wearing a mask and then take it off when you eat. But I think the more important choice is that initial decision of whether you're going to go out to eat or not indoors, and that's should be taken on a person by person discussion.
还有回答你的问题了哦。那我回答我自己的思考哦。因为煮出来的食物基本上已经没有病毒啊，所以这一部分不用担心。你现在担心的是附近的人一起吃的人有没有人带病毒哦？这个呢，它是有一些序列了哦，你不要在通风口的最后面那一段啊，哦，这些就是你要找位置。那现在餐厅里面大部分都有保持距离。那这个病毒呢？不是说你在他前面坐一下就马上中奖哦，这个是他有一个距离，他那个病毒从那个人有带症状的人，或者说有带病毒的人呼出来的，他有一个距离的哦。那你说在吃东西的时候会这么恐怖的传染吗？我们是不太认为这样的哦。那所以呢，这是个人选择了。那基本上因为去餐厅吃。传染的比例并不是很高了哦，那除非你坐的位置刚好是一个传染源，它从那边一直吹风过来，那你当然会，但这种比例并不高了哦。那这样变成个人选择了，那这个你说要这样都不敢去餐厅，那当然是可以啊，就不要去，不然就是买回来。那在里面吃的，那现在都有一个距离呢，应该是没有问题。那如果还是会确诊，那就是也是这个自然的那个了哦。 的那个状态，大家有跟没有跟感冒病毒一样只是没有那么恐怖而已。所以呢，它是个人选择的那这个社会要继续运转呢，不可能就完全封起来，封起来是不可能。所以呢，这个大家自己决定。那开始的时候，它是中间都会有一个隔离板那是更好的所以最近看到台湾还是大陆的有人用纸箱子包人躲在纸箱子里面吃都在餐厅里面那其实我们在健康疗养院，它是有隔离板每个人都有隔离板，所以不会传那我的想法是，如果你一定要这样的话，你就戴个面罩戴个面罩，大家都戴面罩，它不会传得多远而且呢，你如果有好好的养生的话呢，抵抗力强呢，那个病毒不是说你吸一支进去你就会确诊是要吸足够的量，它在你的咽喉里面定下来了才开始传所以呢，如果说让它不要，它在你的咽喉的时候，你的免疫力就已经开始消灭到多就没有问题，所以病毒量不能太多了那也不是说完全都没有这个是不可能所以这个是个人的选择，但是呢，我是不认为该怕成那个样子所以要吃以前戴口罩，要吃的时候赶快打开来，吃几口马上又戴上去，这种是太过度了不太可能这么传的。OK，
我觉得坐在外面，如果外面有位置，坐在外面是比较好的选择。
对呀，那个更好。
对，
那个更好。
Can I have another question, please? Can I have another question?
Oh, absolutely.
Yeah. Do you recommend the second booster shot for most of us?
Yeah, for this audience, yes, I do. If it's been 4 months out from your last booster, yes, I do. I'm giving that to my patients. If you ask me to project forward, I think that it'll end up being about a yearly booster. Yeah, I do. People often ask me, am I going to have the same reaction with this 4th booster that I did with the other 2? And yes, that's typically what I'm seeing. Like if you were feeling, if it made you a little fatigued and sick the day after on your 3rd or 2nd shot, it'll probably do the same. So, plan for it a little bit. And then this is also anecdotal. I do not, this is a thing I'm going to say, but again, please talk to your doctor. And I don't have the best data behind this recommendation. But personally, I had my parents, they had 3 Moderna shots, and I had them get a Pfizer shot just for a little more coverage. The vaccines are very similar, but just a little bit different. And so like with my parents, they had 3 Moderna, and for their 4th booster, I had them get a Pfizer to give a little more coverage.
So you recommend a combination?
I'm gonna parse my language here because I'm being recorded. This is what I had my parents do. My personal recommendation for you, I don't know enough to make as much of a recommendation, but it was my personal thought for my folks. I liked the idea of getting a little bit of frankly, a little bit of broader coverage because the Moderna and Pfizer vaccine are very similar, but they're also just a little bit different. And so in terms of kind of showing our immune system a little broader variety of alleles that our antibodies could recognize, I liked the idea of a combination. Yeah. No
So
great data behind
I
that. It worked out fine for my parents. Combining it is low risk. And so I'm happy to share that.
So if I have 3 Pfizer, I better to get the 4th one with Moderna, right?
So if you were my mom and my mom had said, hey, I had 3 of these Pfizer, I would have told my mom to get the Moderna on the next one.
Okay.
Yeah.
Thank you.
Again, please discuss that with your doctor.
大家听得到他不表态了他只是他个人的意见，他建议他的父母亲打，那也是改变不同，就Moderna改成 Pfizer 这样改基本上是合理的我们就是开放，可以选择这样。那有没有证明比较好吗？这个现在还没有完整的证明那他 他是同意说打第4针哦，因为这个诊所一定是要准许这样。那还是有很多在怀疑第4针是不是值得打哦。我个人是认为再等一下哦，因为现在如果说中国大陆那边大量的流行，是不是有新的突变种出来？那时候再来考虑我们的疫苗对那个有没有效哦，那时候再打也可以了哦。那如果说除非我们华盛顿州的疫情突然爆发的厉害，那时候再来打都来得及哦，因为他打了几天以后就抗体就大量增加了嘛哦。那现在去打呢，等个2个月以后又没有了，那抗体就慢慢降到很少。那你是不是还要再打？哦，这个是个人的选择。哦，所以呢，我的角度是在等。那他是因为诊所的关系呢，他病人来他一定要打。哦，所以呢，这是国家政策嘛。哦，所以呢，现在医学方面很多正反意见了。哦，大家还是在质疑要不要打。哦，这样，那这是我的角度。那他的角度是说 OK， 要打。那有一位感染科医师我提过，他说我都不晓得什么时候会没命，我现在已经70多岁了，我就打嘛，打了以后就怎么样，有一点保护嘛，哦，也可以了哦，这样，所以个人的选择了。那我们现在基本上还在，我是建议再等一下这样 ，OK。
Oh, thank you for the questions. Yeah.
还有没有问题？再人家讲下一个题目咯。Okay.
Happy to tell you what I'm doing with my kids too. Both of my children, we gave them the 2-shot series, but I've chosen not to, nor are there guidelines that kids need boosters, and I don't think my kids need a booster. I think it is important to recognize that this is the relative risk is very much stratified by age and other health conditions, and that an otherwise healthy school-age kid who has received the 2-shot primary series, I don't think that, my personal opinion is that there's very little benefit to a booster at this point. Going forward, I can absolutely see this being kind of like a yearly flu shot, but yeah, I don't have my kids boosted, and I don't see a reason that they need to be. Both of them are otherwise healthy and not immunocompromised. Certain pediatric populations absolutely need a booster, but just in terms of my kids, yeah, I don't think my kids need boosters.
他对他的小孩子，他就不认为该打第3、第4针了哦。呀，因为我也是认为，除非非常紧急，那我们才打，不然的话再等，因为这个疫苗打进去就在身体里面了。那后续的长远的问题现在都还不清楚。OK， 那大家还有没有要提供意见的？不然就要下一个题目喽。Next topic.
Yeah. With no other COVID questions, or you're always welcome to go back to it. Moving on to hopefully a little lighter topic of memory. And when kind of asked to spend some time with you today, one of the things that patients ask me a lot are what are the things I can do to either preserve or improve my memory. And so I'd like to go through 7 recommendations that I have. So next slide, please. So spoiler alert, there is no magic in terms of recommendations for preventing memory loss or preserving memory loss or improving memory. Still, one of the most important things for all of our health is to maintain an adequate level of physical activity in our daily routine. If we want to put specific numbers on it, It's at least 150 minutes a week of physical activity that elevates our heart rate, and it doesn't matter what it is. I like to think of it of that as our heart rate is elevated, as we're taking deeper breaths in and out. I just visualize very oxygen-rich blood being forcefully pumped up into our brains and bathing our brain, the cells in our brains with just nutrient-rich oxygenated blood, sort of clearing out the spider webs, clearing out the toxins. And so if we want, still our number one recommendation, if we want to preserve our brain function and keep our brain healthy, is physical activity. Brisk walking, chair exercises, stationary bikes, whatever we enjoy. Mixing it up has been shown to help.
就是有他的很多病人也是常问他如何预防失智那他说没有什么特别不一样的大家都知道的那当然是第一样就是要活动要活就要动那大概150分钟每个星期能够增加心跳的活动那不一定要说一定达到心跳120啦多少增加心跳它主要目的是增加心跳呢让血可以打到脑部，那增加脑的氧气的供应量，也可以清洗掉脑里面的一些障碍废物这样那就是会比较可以预防痴呆了所以任何活动都好，只要稍微增加心跳，让你的血氧还有循环好，这样都对了这样所以呢，大概一个星期150分钟的这个等于有氧运动Okay.
Next slide, please. Again, there's no magic, but in order to preserve our memory, it's important for us to use our minds and staying mentally active in engaging activities. And so this is a distinction. So staying mentally active, unfortunately, it doesn't mean reading as much or like watching TV or passively watching something, but actively engaging with an activity such as crossword puzzles, playing bridge or card games or board games. Playing a musical instrument is much more beneficial for memory than listening to music. That's the distinction I'm trying to make. So playing music is staying mentally active. Listening to music is enjoyable and is a great activity and is a way to reduce stress, but is not a mentally active activity. And so that's what I mean by that.
再来就是脑力激荡的脑力的运动的也就是说你一定要去脑筋去主动的去做的事情，而不是被动的东西了那刚提的是听音乐是一种享受，但是使用乐器就是弹歌曲了，这个呢是脑的主动的运动这不一样所以呢同样的要念书跟看电视是不一样的这样，所以呢这个是就是一定要主动的去做像我们这里的这个 healthy living 也是一样就是主动的要去做的事情所以呢我们一直鼓励大家的提供你自己的活动来分享，这个是很重要的过程就是要主动的去做的，而不是被动的那一种
Next slide, please. So one of the best ways to engage our brain is to socialize. And also in terms of some of the most data behind memory loss is unfortunately social isolation is very much associated with memory loss because if we are able to meet with loved ones, friends, talk, discuss, make connections with other people. That engages our brain. It gets things moving. Socializing regularly is one of my strongest recommendations for memory preservation. And I feel like I'm speaking to the choir here because you are already, you're a self-selected population of people who are looking for opportunities to engage with their community. So I really commend you for that. And also, again, kudos to Dr. Chen and to Kinan for providing these types of environments.
大家就是社会联络网socialize 这些呢，我们 healthy living 银华族这些活动就是主导，就是要大家一定要参与而且呢面对面参与是更好的那个是很重要的训练那绝对不要自己待在家里说看电视呢是被动的那一定要主动的做一些分享这些非常重要所以呢 social networking 是非常重要要面对面的更重要所以大家要记得那多参与这些活动才能够以后不要被抓去住疗养院那很可怜
Next slide, please. This recommendation is not so much in terms of actually preventing, but in terms of performance. Like if you want to do better with performance of memory, getting organized is actually one of my biggest recommendations. And this is where keeping notes, making lists, having an appointment calendar, actually kind of living in an organized environment, making sure that daily, making the bed, picking up, not having too much clutter in the living environment, and also limiting distractions for if you're trying to do too many things at once. Unfortunately, you probably won't perform as well as you used to. So getting organized is I do love this tip.
这里就是你的生活点点滴滴呢都尽量规律有组织化了不要懒懒散散什么都没有 organize 这样的话呢到时候你哪里什么事情都不记得一定要规律化而且组织化比如说你要记下来要做什么呢都要好好的规律的就像你的自己的房间要整理这个是功能性复健functional rehab 一样所以打扫房间自己的事情处理好 organize 这个都很重要那所以失忆症常常看到的就是整个房间乱七八糟没有整理那个就是最很标准的症状所以呢尽量规律化而且尽量有整理了你的生活各项点点滴滴都要好好的 organize 就是了OK
Yeah, like this one, like if I don't put my wallet and keys in my one spot when I get home, I've lost them for so many minutes if they didn't go in the right spot. That's what. Next slide, please. Good restorative sleep is very important for brain health. And so this tip is just paying attention to that, making sure that you are getting adequate time for sleep, that your sleep environment is comfortable. And then another, maybe a little more specific recommendation is if you do have a concern for sleep apnea, getting a home sleep study. Because untreated sleep apnea, heavy snoring resulting in someone waking up very frequently, like 30 times an hour, because they're not able to, because their airway closes at night. It doesn't all, if you have those conditions or if you're not sleeping well, the brain doesn't get its chance to reset every night. And it doesn't get its chance for those restorative pathways in our brain that kind of clear out some of the toxins that build up, as we stay awake. Nice, deep sleep is very important for brain health. And so paying attention to our sleep will help us preserve our memory.
大家都知道睡眠对 预防失智是很重要的。那想尽办法改善你的睡眠环境、睡眠卫生，让你有一个好的睡眠。因为睡眠等于是我们脑筋在清洗，清洗我们的脑的这个各部门。那你睡不好，它就没办法真正的清洗掉那个不要的东西。那这样累积太多，它就容易失智。所以呢，睡眠大家好好去培养那个睡眠环境，就 sleeping hygiene，那个睡眠的卫生习惯呢，去整理好呢，就可以比较好的睡眠。
Next slide, please. Can you go back one slide? And I'll put those in. I have two more recommendations. Just imagine instead of it saying sleep well, it says eat a healthy diet. Because again, our brain is an organ just like any other organ in our body, like our kidney or our heart or our lungs, and that those cells need the correct amount of nutrients to function properly. And so a nutrition plan or a diet that is mainly plants with limiting heavy processed foods such as anything with high fructose corn syrup or trans fats. So a diet of mostly fruits, vegetables, lean meats has been associated with better memory.
另外就是说，他提到的就是吃了吃对保脑的补脑是很重要。那么吃什么呢？就尽量就是基本上就是地中海饮食了。肥的少吃，尽量瘦的。那还有什么？吃的东西里面。大概就是健康饮食了。我刚刚就在想，他讲的大概就是地中海饮食。那我有失智了，是记不起来。他就大概就是这样。那好好的健康饮食就是了。
Yeah. And then the seventh and last tip is manage chronic conditions. And by that I mean, if someone has diabetes, if their diabetes is uncontrolled, they're more likely to have memory problems. And so controlling blood sugars, controlling blood pressure, if someone has a lung condition, like COPD, stopping smoking, using the correct medications, optimizing our health improves our memory. And so that was the final recommendation.
那身体我们到老了都有很多病该好好的治疗，增加我们身体的功能，对这个脑筋的功能是很有帮助的。他讲的几样病，像慢性肺病啊、糖尿病啊，这些呢都会影响到我们脑的组织变化，要好好的治疗。遵照你跟你的医师同意的方式，那好好的治疗来增加脑的功能，这是很重要的。大家不要抽烟啦，不要酗酒啦，这个都是很重要的。
Can I have a question?
Absolutely.
Yeah, this question is for both Dr. Taylor and Dr. Chen. And this may not be related to memory, but it has something to do with brain. We often hear a term like, don't overuse your brain. Just 不要用脑过度啊。So what does that mean? Don't overuse your brain.
Here's my guess, is that try to limit distractions. Is that we perform better when we are able to maybe focus on, no more than let's say 5 things at a time, especially if you're a mom, maybe 10. But too many times we have too many signals coming to us at the same time, especially with technologies like I am, tethered to my phone and things. So it would be my suggestion that we try to limit distractions, would be how I would respond to that.
刚刚 Peter 问的用脑过度呢，我的解读是你电视看太多，那看的电影啊或什么看太多，脑筋大乱啊。那我们这个年龄呢，是比较重点在于你选择你需要做的，对你的健康有帮助的活动。那你看的东西、看的节目呢，看这些东西也是选择你要的，然后比较专心的去看，然后去思考、去做，这样比较重要，而不是参加很多活动、看很多节目，这样呢是等于你脑筋收集的资讯大乱哦。你要记得，你所看到的每一样东西都会投射到你的脑里面去。它就会占用你脑的空间很多地方，那而且它是到处乱放，它不是集中的，就好像你念了很多资料，那你的书放在哪里都很乱，那时候你就是到时候要找不到，所以呢，建议基本上就是选择性比较单纯化的活动或你看的东西，这样就不会过度，你讲的用脑过度了，那也就是说，你把所看到的、收集的资讯、听到的东西全部放在脑里面，到时候脑就是大乱而已。就像我们的电脑收集太多的资讯放到电脑里面，你没有把它 organize 的话，它就是乱而已。那乱的话，失智就是你找不到你要的资料。这样，所以呢，这Peter讲这个也是很有意思的用脑过度其实意思就是要你 organize。你要的跟不要的，那你要的去专心去看、去做、去学，其他的不要去看，大乱而已并没有帮助
Yeah, it makes sense to avoid distraction, but we really cannot stop using brain. We just keep functioning. We think of things all the time. So I hear that term often. Don't overuse it. But I really don't know how to deal with it. I keep using it all the time.
Yeah, I have one more comment as I think about that too. I tend to think of myself operating in kind of three states when I'm using my brain. Either I'm kind of not getting enough activity, and maybe I'm even bored. I've kind of dipped down into that. Maybe I'm bored. I'm not getting enough things on my plate where I actually feel like I want to do more, and then I start kind of looking for things. And I get up to what I call my kind of inflow, where I'm getting enough things that I'm engaged, I'm a little bit challenged, I'm active, I'm doing things. And so I'm kind of in that middle level, where I like to call it, kind of inflow. But unfortunately, it can go above that, where now I'm getting too many things on my plate, and I'm starting to feel overwhelmed. And that overwhelmed feeling is causing me distress. It's causing me stress. I'm starting to have a stress and anxiety response. My body is starting to put out some, fight or flight hormones, adrenaline, things like that. And that's actually going to do a little bit of damage to me. I'm running the engine a little too hot. And maybe I do need to take some things off my plate, limit some distractions.
这个就是使用脑过度对身体各方面都是刺激嘛，对不对？我们任何一种刺激对我们身体，像肾上腺素啦，那类固醇的刺激啦，甲状腺素的刺激啦，这些对身体是一种刺激。那你如果过度的刺激，它对我们身体就是一种过劳。那过劳，你身体就开始不接受这些事情的时候，就会往那个不好的方向走。所以呢，就是说基本上还是要达到适当的范围就好。那用脑有没有过度的，这个就是看你适当的时间、适当的范围、适当的种类去做就好，不要乱的那个的资讯。这样的话对身体的压力就不要那么大。这样。
Thank you.
Well, before we move on to more questions, I'd like to say that a common thing that comes to me as a question is, when should I talk to my doctor about memory concerns? It's very normal for people to have a little more delayed time and recall of names and words. But when it's time to talk to your doctor is if you or a loved one or family member is noticing that memory problems are causing loss of function in daily activities. Such specific examples: difficulty managing finances or paying bills, and difficulty in remembering to take medications. That it's, unfortunately common that people will be on maybe 4 medications. If someone is consistently forgetting to take their medications, that is kind of time for them to at least go talk to their doctor and get a memory screening test.
这是很有意思的题目哦。什么时候该跟你的医师谈哦？这个个人本身是不一定会主张要跟医师谈，那大概都是家属发现说他开始有变化哦。那比较明显的就是几样了哈，像你自己房间没办法 organize 了哈，那该付的账单也都丢在地上或丢在一个地方都不理了哈，那该吃的药也都忘记了，这些呢，患者本身是不会记得，他也不会想到说有这个问题哦，但是大部分都是家属，那时候就是慎重，一定要去跟医师谈，因为要做该做的检查，好。那其他的就是要参加这些活动啦，保持这个功能啊，这些活动。好，我们用差不多来。
Yeah, and then the other question that commonly comes to me is, are there, what vitamins or what supplements can I take for my memory? And my first answer is, in the majority of people, a healthy diet can provide the majority of vitamins. A diet heavy in fruits and vegetables and green leafy vegetables. Now, after that, though, there are 2 vitamins that if someone is deficient in those vitamins, it can affect memory. And those specific vitamins are vitamin D, D as in dog, and vitamin B12. In the Pacific Northwest, there is a higher incidence of vitamin D deficiency in the population simply because of our cloudy weather, northern latitude, and also a propensity to stay inside more. So I can say that I had myself tested about 2 years ago, and I was a little on the low end of normal. So I, in the wintertime, will sometimes take some vitamin D supplements. And so if I had to, so I'm putting that out there. Also, vitamin B12 is a vitamin mostly found actually in meats and not as many vegetables, although still can definitely be found there. A vitamin B12 deficiency can contribute to memory loss. And so again, when I have a patient who comes in with concerns for memory, I will often draw a thyroid, vitamin D, and vitamin B12 as some screening tests for someone who is having trouble. Maybe they're forgetting to pay their bills or take their pills, have concern for memory. So I'll draw those 2.
至于吃维他命的部分哦，基本上我们对失智的衡量呢，基本上是朝几个方向的，一个是甲状腺功能太低，那心理，那比较有证据的是像 B12 啦、维他命 D 啦这些不够的，它会影响到脑的功能哦，所以呢这一部分的是可以去 吃这些了哦，就 B12啦，哦，还有像维他命 D 啦这几样哦。那基本上大部分的人都不会缺乏哦，当然是有些刚刚提这个我们西北区的，大家出去晒太阳的机会不多哦，那么就比较容易得到 D 不够哦。那我的经验是素食的人，他因为不吃肉，那么 B12就比较不够哦。那另外有一些人是节食的很厉害啊，那就有点像那个集中营啊，二次大战的犹太人集中营，他们的脑部的营养太糟糕了，营养都不够哦，那这也是容易这样。所以呢，基本上维他命大概是 B12了啊，维他命 D 啊，那另外就是甲状腺功能啊，哦，这些是要去检查。大概其他的食物上都有的维他命都不够了哦。
补充一下维他命 D， 因为我最近看了一个那个节目，它是讲说为什么很多人补充维他命 D， 可是都没有效，是因为维他命 D 它是脂溶性，它不是水溶性，所以如果你的 diet 都没有油脂，那维他命 D 它就不能够吸收，所以说这个可能就是你们日常生活中要注意的，就是它可能是饭后吃，因为它需要油脂，所以如果你吃空腹，或是说你平常都不太吃有油脂的东西，维他命 D 就很。
He's talking about the absorption of vitamin D need to be fat, a lipid carrier.
Oh, with that, yes.
So means fasting before meals don't take vitamin D. So you can take it.
Great question. Yeah, great question. Yeah, vitamin A, D, E, and K are all fat soluble, and so absorption rates can definitely be affected. Which is why, like you'll often see vitamin D supplements will be suspended in oils more so than tablets. They both work. The question about taking it on an empty stomach or with a meal, which way is better going to optimize absorption? I am not able to give as confident an answer on that. I would say with a meal, although either ways work. Whatever way works best that someone's going to remember it. If they want to combine it with their usual medications, or if they want to have it kind of on the table with the meal. Fish is a great natural source of vitamin D, and also omega-3 fatty acids, which are good for brain health. So again, in terms of what, another question people often ask me is, what can I eat better for memory? I usually say fish, actually. So that didn't answer that question. I apologize. I don't know the confident answer to that. They both work. They work okay. Which one works a little bit better? I'm not quite sure.
Because you have to have oil to digest the A, E, and K,
Yeah.
So if we don't have enough oil, because a lot of women always diet, so they eat everything with water,
Yep.
So they don't have enough oil to digest the vitamin D, so so they always not enough. So I don't know if that's true.
I think that could definitely play a role. I guess again on a personal note, when I take my vitamin D supplement, I take the one that's the capsule suspended in oil. It looks like the little yellow capsule. So it's the one I take.
Also need to go to sunshine.
Yeah, absolutely. Yeah. Even when you're eating our dietary vitamin D, that last step is, it's processed in the kidney, it's put back in the blood. The vitamin D2 comes out to our skin and is converted by the sun into vitamin D3, the active form. So the sunshine vitamin.
有没有其他问题？大家都很安静。
Can I ask a question?
Yeah.
Does it make any differences between natural B and artificial B? When I choose a selection of B complex.
Mhm.
I'm always wondering. If,
I tend to think our body is better designed to absorb the natural bees better than the,
hard to find.
but very hard to find. I think that the manufactured bees are definitely adequate as a supplement, but I tend to think our body is better designed to absorb the natural.
From east.
Yeah, that's my
But
general.
we don't really become like synthetic.
Yeah.
The vitamins because there are too many chemical compounds
Yeah.
in there to absorb those vitamins.
Yeah,
It's still natural.
yeah. I tend to fall that way on most things too. Our bodies have had millions of years or whatever interacting with our environment, and so they've set up a lot of. I think our bodies have set up a lot of structures for those interactions that they've had for the last millions of years. Versus now we are introducing something a little new. Fortunately, I do have a lot of trust in our Food and Drug Administration. I think they do very good trials. I think we put out safe food products and safe supplement products. But if we were just talking about maybe which I would prefer or which I think are going to work a little better, I think it's already a tried and true if it's coming from a natural source.
Yeah, I have patients. I have patients. She follow the TV guide or the French guide, and then there's lots of different kind of supplement vitamins, but she doesn't want to eat food, so she gets severe anemia, malnourished. So that's unbelievable that she was taking 20, at least 20 different kind of supplements.
Yeah.
That's very different. 所
Yeah.
以呢，这个维他命方面还是自然的最好。那合成的是不太好，太多化学成品在里面。那现在联邦也一直鼓励我们 de-prescribe 就把不必要的药呢拿掉。在长照机构呢，超过5种就称为不应该的。超过8种是绝对要考虑减少。也就是说，它这些都包括维他命都在里面。因为大家是想给老人补嘛，那都一直给一大堆维他命，其实都不需要。重要的是他该吃的饭啦、水果啦，东西好好的吃就对了。所以这维他命大家不要太相信那些东西。该做的运动、该吃的食物，好好的吃就好。
请教一个问题，查出来呢，我缺那个 B12。但是看来呢 ，B12大概缺的不多，所以我吃了几天以后马上就回来了。这个时候，那剩下的这个 B12是应该丢掉呢，还是应该继续吃下去
Yeah, even before. Sorry.
So you can
No, I can't. No, I can't.
He was talking about his diet problem that he has a vitamin B12 deficiency. So after the treatment, he's better. But then he was talking about maybe he need to take the vitamin B12 forever.
Yeah, please talk to your doctor. And just like Dr. Chen had emphasized, very much promote food sources of vitamins over supplements by far. That being said, specifically, if someone has had surgery in their gut and maybe part of the stomach or intestine has been removed, that person's ability to naturally absorb that nutrient is going to be impaired. And then prescription strength doses of vitamin B12 are often necessary in those situations. And so you will see people on 2,000 micrograms of vitamin D daily, and that's needed. And actually those doses are hard to get from natural sources. But if someone's had part of their intestine removed, it's usually necessary. And certainly something I would recommend in those situations.
回答炮的问题哦。有一些人他有肠道系统的病哦，那尤其是有肠子手术割掉一段的这些病情，他对 B12的吸收很不好。这种情况下是一定要治疗哦，一定要吃哦。那我有遇到过的是吃都没有效，一定要用打针的哦，因为它没办法吸收啊。那 B12的吸收是在胃酸还有肠道的细菌这边在帮忙吸收。那么素食的人，他食物里面没有 B12，所以只能够吃肉哦，尤其是肝哦，猪肝啊这些，它的 B12的量比较高哦。所以呢，有这种缺陷的人啊，这种疾病的人就一定要吃，或者要用打的哦。所以这个是治疗用的哦。那平常很多人就说，哦，我老了，就吃一个这个吧，吃一个那个吧，哦，那个基本上看起来是不太需要的哦。你有正常的饮食就不需要这个。OK。
Dr. Taylor?
Yeah.
I have a question, not on vitamin, but on supplement calcium.
Yeah.
Especially for female, often with osteoporosis or osteopenia, and then especially Asian are not intake enough dairy product to increase the calcium to 1200 milligram a day. Therefore, supplement of calcium is recommended. And as aging, which is, you know, even healthy person is aging, the artery is not clean as young. So calcification is become, you know, by aging as one of the factor because of aging. Not necessarily 100% on everybody, but, you know, some. So is there any concern by taking high dose of calcium supplement may interfere with, or I shouldn't say interfere, may leading to plaque in general as aging go on, and then causing the artery, you know, issues?
Would it be fair to rephrase your question? Is there a concern that taking a calcium supplement could contribute to buildup of plaque in the arteries?
Yes, the calcification in general.
Yeah. Great question. Yeah. It's actually been looked at a bit. I don't have the data in front of me. In specifically women, the benefit in preventing thinning bones outweighs the potential risk of contributing to risk for heart attack and stroke with calcium supplementation. In men, the data is much less clear, and there is a higher concern that calcium supplementation could contribute to increased risk of heart attack and stroke. My current recommendation is that women over age 65 get a bone density scan about every 2 to 5 years. And if there is any demonstrated bone loss, meaning osteopenia or osteoporosis, or if we're seeing thin bones, then in women, I absolutely do recommend calcium supplementation of I recommend 12 to 1500 milligrams a day of calcium carbonate or calcium citrate, along with vitamin D. Personally, I'd recommend at least 2,000 units a day if someone has thin bones. In men with concern for thin bones, DEXA scans can absolutely be obtained. And in a situation with demonstrated thin bones, or say someone has had maybe some fractures, maybe they've had some spinal fractures or they've broken a hip, and there's concern for thin bones, then I do think calcium supplementation has a place in men, but there is a higher risk for concern of increasing the risk of heart attack and stroke. So again, we take it on a case-by-case basis. So that's my thoughts.
Thank you. Is any blood test can indicating like calcium, serum calcium, indicator can watch out to keep eye on to make sure it's not over consumption or the overconsumption may be, I shouldn't say over, taking the recommendation, but your body is not utilizing in the right direction, pushing to bone, but pushing to blood stream instead.
Yeah, the quick answer is no. Actually, serum calcium levels aren't that useful in terms of following bone density. And I don't know enough to answer the why on that. Certainly, vitamin D levels, kidney function levels, actually thyroid and parathyroid hormone levels should be considered to be looked at, but actually following serum calcium is not as useful in that situation, my understanding. I appreciate Dr. Chan's.
Thank you.
哎，是这样，那个血里面的钙是一个平衡点，所以呢，它会从骨头里面把钙拉出来，然后我们血又会把骨沉进去，所以测量血的钙的浓度并没有帮助，那个没有意义，除非你真的有一些病需要检查它的钙，那骨质疏松这一部分呢，是我们都要去做的努力，一定要运动，才能增强它骨的硬度。那钙呢，照建议是1天150 mg， 你吃的肉、蛋、鱼里面都有钙，所以你要去衡量你大概吃的是什么东西。真的说都是吃素的，什么都不吃的，你才有真的缺钙的，所以要去衡量一下。但是我们大部分都没有注意到，说你吃的食物里面也有钙，所以呢，也再去吃那个钙片，那就是吃超过量，那这样的话呢，当然他刚 Dr. Grant 讲的是对女性来讲是还算恰当，你要补充了什么？那对男性来讲，现在就是大家有点担心的，就是胆固醇太高，它会沉淀在血管上面，然后你又吃高钙，那么它会让动脉硬化的厉害，这个是一个互相的头痛的问题，那我们也没有真的答案，但是就是说个人要去讨论，你如果胆固醇高又有家族病历、中风、心冠状动脉问题的，你钙片要吃多少？这个建议是800到1500的话，你就吃800就好，这样你自己去衡量，那钙片超过了，它当然就是沉淀下来，所以呢，这个是影响，主要的是冠状动脉那边的钙沉淀太厉害的时候，它就塞住了，所以这个是每个人要去衡量你的家族病历，你现在的医疗的现在的病情，然后来决定你该吃的量是多少，当然我们是希望达到中间点就好了，不要太过分。所以变成说，你吃的食物里面，如果都吃了很多钙的成分的东西了，你又补很多钙进去，那么你又吃维他命 D， 那么吸了一大堆钙片到身体里面，它没有地方跑，就沉淀下来。那动脉硬化里面最怕的是新鲜的、很脆弱的那些胆固醇，然后钙片沉淀下去，它很容易掉下来，那么就引起中风和心肌梗塞啦，这些。所以呢，如果说你的钙的检查，那个去做心脏的钙的沉淀的检查，如果都很稳定的，当然也是大概不会有大事的，所以呢，像我们颈动脉carotid artery 那个颈动脉，现在就是联邦政府准许我们至少做一次，去看看你那边有没有胆固醇高，然后有没有那个胆固醇的碎片在那边跑来跑去、动来动去。那个就是危险的，那你如果又吃很多钙，它那边就容易沉淀下来，这是几点，是大家可以思考。但基本上还是，talk to your doctor，最好。
I just want to throw out also some non-dairy calcium rich foods. I Googled it, of course, to remind myself. Oranges, tofu, almonds, broccoli, kale, navy beans, and you raised a good question about calcium supplements and arterial calcium buildup. Interestingly enough, there's been some good data looking at, sources of dietary calcium do not seem to contribute to concern for increased calcium buildup in artery. And I think that speaks to a little more of how our bodies are designed to absorb natural sources of nutrients as opposed to the supplements. But again, sometimes supplements are absolutely necessary in certain conditions. But I think it's a good point to look for calcium-rich foods, non-dairy sources. So,
yeah, I mentioned that in our daily eating, lot of stuff already has calcium, so you don't need to follow the guideline. 1500 milligrams a day. Calculate your daily diet.
Yeah, tofu's actually got a pretty good calcium source. Great questions. Oranges, yeah, oranges have good calcium. Yeah.
陈医师，那个早期的 memory loss， 如果说增加这些食物的营养可以改进，那如果晚期呢，可以改进吗？可以帮忙吗？
你说食物来治疗
这个 memory 的这个对失智，晚期
用吃来补助失智这一部分，可能没有很大的帮助除非你真的是营养不良的那一种就需要用吃来补助那大部分脑部的失智的部分，就是因为它太多的脏的东西沉淀在里面就是说它循环不好那我们每天收集的资讯，对我们脑来讲都是不必要的东西很多变成它一种讯号沉淀在脑的整个传播系统里面，那一部分就需要靠循环还有睡眠来清洗所以你看我们的电脑要清洗定期清洗就是这样所以用食物来补脑这一部分呢，基本上一般人是不需要的所以你说到失智严重了再来补呢，除非他有这些营养不良才能再补看看不然的话大概已经伤害的就已经伤害，很难再补回来所以才说要我们20年前的银发族还有现在 Health Living 一直鼓励大家要参与这些活动来清洗你脑部里面的脏的东西这样才能够好好的有功能那营养方面该有的食物都有，你说失智了以后再来补大概来不及
好，谢谢。
Yeah, thank you for the question.
还有没有？希望对大家有帮助。好，那我们今天就到这里了。
I have a question.
Yeah.
Can you cover a little bit about monkeypox?
Oh, monkeypox virus. Sure. Monkeypox virus was originally identified in the 70s, endemic to Nigeria, certain other Central African republics, and unfortunately had not been seen outside of Africa until, I believe, pretty late. Yeah, there's been a couple of cases in Britain. But just very recently, there was a case identified in Massachusetts. And so there has been a health announcement sent out to all US providers to be kind of on the watch for it. Tends to be a vesicle forming virus, actually often in the groin area of a pretty large, firm vesicle that then tends to ulcerate. And is usually presenting with fever, inflamed lymph nodes. In terms of disease severity, unfortunately, it doesn't doesn't seem to kill people, but can be disfiguring and leaving scars. It's very interesting. I've never seen it. I think the risk to the general population is low, but it does. It is interesting. Yeah.
麻辣在担心猴痘哈，不用担心的。
I haven't pulled up on my other computer because I was reading about it yesterday.
至少我们在美国现在才几个 case 哈，那它死亡率
I
很
was
低
just thinking if I could, I don't know.
到 10%， 但是看地区哈，
Next time.
基本上是西非跟中非的地区的病哈。那因为大家现在旅行到处跑呢，总是传出来，大概已经相当久了，只是大家都没有看到，也没有注意哈。现在才几个 case 出来，才在注意了哈。那所以说话呢，我想是不用去担心这个，那个 case 还是太少，而且它的引起的传播率也不高了哈，所以不用担心，还是我们吃喝玩乐，好好的过日子比较重要，不用担心。也没有什么治疗，就感冒的症状这一类的症状而已。那当然，美国是在注意啊，这个全世界都在注意的事。OK。
Yeah.
Thank you.
Yeah, and also it looked like transmissibility required pretty close contact.
Yeah.
Doesn't, yeah. So it's not a respiratory virus. So just like to say, I don't think, my personal opinion is that I don't think our level of concern needs to be high. Concerning, interesting, being on the watch for it, but transmission appears to require close contact.
Just have a good time. Don't worry.
I wouldn't worry about monkeypox. No.
All right.
Dr. Taylor, if I get COVID, just for example, what kind of medicine I can take?
Yeah, Paxlovid is pretty readily available. It works by slowing virus reproduction in the body. It's a combination of 2 antivirals. Paxlovid. If you get COVID and you have another comorbidity such as obesity, hypertension, kidney disease, COPD, diabetes, then you can go to a walk-in clinic or talk to your doctor, and they may be able to offer you Paxlovid. And the availability is pretty good. Most pharmacies have it. Should definitely be prescribed because it does have a lot of interactions with some other medications that are also metabolized in the liver. Specifically like statin medications. So like if somebody is taking a cholesterol medication like atorvastatin, and we're going to put them on Paxlovid, we would have them stop their statin and take the Paxlovid. It also interacts quite a bit with most anticoagulant medications. Like if you're on a blood thinner, Coumadin or warfarin, we would want to monitor that closely. In some cases though, like in Paxlovid, it's pretty neat. Yeah, it's great that we do have a treatment. It has to be within the first 3 days to be effective, and absolutely helps reduce the severity of the disease.
Yeah, now people tend to hesitate to report to the doctor until it passes time.
Yeah, it does have to be
现在就是吃那个 Paxlovid 的 Paxlovid 的，基本上是都有了哈，只要你有确诊都可以。但是呢，现在就是要衡量哦，你要跟你的医师谈的，就是他要仔细看。现在连药剂师都要监控哈，因为他要知道你现在吃的药会不会引起问题啊？所以呢，这个 Paxlovid 呢，我这几天也有开，但是呢，后来大家决定还是不要吃哈。那我最近健康的 case 也是都是80、90岁的老人哈，那他们身体一大堆问题以外，就是吃了很多药，那你要决定是哪一样比较重要哈。那这样，那基本上这些 case 都没有用哈，那也都恢复了。所以呢， 只是说知道就好。那大概要跟你的家庭医师谈，就是你现在吃的药，还有你的其他功能啊，肾脏功能、肝功能，这些都是问题。哦，还有很多，它会跟很多药产生药与药之间的副作用。哦，所以呢，可能药剂师也要牵涉进去，他要看那可不可以用哦，并不是说你随便开一个单子就可以拿哦，他们都要看一下。哦，那基本上我最近遇到的都是没有吃药都好了。哦，就是2天稍微感冒一下就过了。哦，所以呢，注意就是了。那大概家里要准备的是那 oximetry 哦，测氧气的量的那个机器啦、体温啦，然后你自己注意症状。如果超过2-3天，那你看看症状有恶化，那么一定要吃这个药，不然的话是大部分都是自然好的。哦，所以呢，随时注意一下你本身的身体状况，有没有肾功能障碍、肝脏功能问题，还有你吃的药，哦，然后来决定是不是该用。哦，这样。如果有症状，第一一定要去做筛检。哦，现在大家不太做 PCR， 做的是 screen。哦，大家可以马上知道你有没有确诊，但是呢 ，screen 做出来阴性，并不代表没有。哦，所以变成第2天或第3天还要再做一次，看看有没有确诊。好，那有确诊你就可以考虑吃这个药。好，那对轻症跟中等的有效，重症的就没有效。好，重症一定要去医院打针了。OK，
谢谢。
好，我们已经12点多了，大概到此为止吧。还有没有问题？或是有什么？
Anything to add? I'd just like to end on a positive note. I do think in the United States we're headed towards an endemic COVID situation, and I hope everyone has a wonderful summer. And thank you for the wonderful questions. And yeah, again, that we do now have some therapeutics with COVID, like Paxlovid is again, we should feel good about that. Yeah. Again, thank you very much for inviting me to spend some time with you today. I very much enjoyed it, and thank you for the challenging questions. And how about one more question, or we can wrap it up? Yeah.
Yeah. 还有没有问题？最后一个，不然就要结束这一次今天的演讲哦。哦 ，OK， 好，那 I think that's it.
Yeah. Well, I hope everyone has a wonderful day. Thank you.
谢谢大家。
Thank you so
Thank
much.
you, Doctor.
Thank you.
Thank you,
Dr. Taylor.
谢谢陈医师。
Thank you. Bye bye.
Thank you.
拜拜。
Thank you for coming
Thank you.
today's seminar and our MediHealth lecture. And we are very honored to have Dr. Taylor to come here to have a talk for us today. So we have a little gift
thank you.
and appreciation certificate to Dr. Taylor.
Yeah.
And
Yeah. Should get a picture. Actually, yeah. Oh, we're gonna do a photo. Hang out here.
yes, of course. Yes, of course.
Oh, thank you so much.
Yeah,
I appreciate it.
Okay, one more.
Yeah.
Yeah, sorry.
Oh, I appreciate it. Thank you so much.
Thanks for
Thank you.
coming.
Thank you.
Thank you.
Thank you. Bye bye.
Thank you, Dr. Taylor.
各位今天的参加，然后我们之后还有1月份还有两个那个到场的这个演讲，也希望大家能够多多出来活动一下。我们6月份会有 Beatrice 老师到这边来跟大家分享这个如何用高科技过这个 COVID 生活，然后还有我们会有那个吴美德老师跟那个黄文亮老师会跟我们分享怎么样获得好人缘，还有我们华州的健行的一些步道的建议，或者是说健行的时候应该要注意什么东西，非常欢迎，也期待大家过来。对，6月4号我们要那个陈医师会跟大家分享，这个也是 in person 的。6月4号陈医师也会跟大家，还有其他的这个 我们东区的会员朋友们也会跟大家分享他们上一次去 Lectureland 的这个旅游的规划，还有他们去的很棒的一些景点。
还有庆生会，大家
对
搬到
庆生会
那我们煮台中的麻薏汤来。哦，
所以那一天会 live， 就是参与的人就是可以自己煮一样喜欢的东西，跟大家一起分享。6月4号。
哦，那我们讲 lecture 有很多点，里面有很多资料。哦，那我们那天会比较仔细谈。哦，那大家来尝试台中的麻薏汤哦。OK， 好，拜拜。
谢谢大家，好，拜拜。
Great.
Yeah, that was very enjoyable. And I'm sorry, I should have thrown some more slides in. I actually have some stuff on.